Hello everyone, this is Dr. Rukmani Choudhary and you are watching Dr. Rukmani's Health Update. My today's topic is frozen shoulder. So in this video, I'll be talking about everything about frozen shoulder, like what is this condition, how it occurs, and who are at higher risk, what are the causes, sign or symptom, risk factors, diagnosis, best effective homeopathy medicine, treatment in allopathy and treatment in homeopathy. So you're requested to watch complete video for complete information. If you're watching first time, please like, share and subscribe my channel. Press the bell icon to get notified. Frozen shoulder. This is quite common, pretty common nowadays, and as the name suggests, frozen means you are not able to move your shoulder. Like there is a stiffness, remark stiffness. So this is a kind of condition, joint problem. You are not able to move your shoulder and you are having stiffness and there is a pain. At times there is a swelling, and this is like usually after recovery stage. This part, first let's talk about the shoulder joint and why you are not able to move and what's happening inside, means the pathology or the joint problem. The shoulder joint, this is made up by three bones, and that is humerus, your arm bone, and the clavicle, your collarbone, and the scapular, your shoulder blade. So these three bones usually make this joint, and that is shoulder joint, and the surrounding tissue, that is called shoulder capsules. So at times there is a stiffness of this shoulder capsules, and at times there is a decreased synovial fluid. Synovial fluid is the fluid that obviously supports, and the joint fluid, we say stiffness in the shoulder capsules, and there is less synovial fluid is found. So this is how the condition occurs. Stiffness is there, swelling is there, and restricted movements. There is no clear cause, there is no direct cause, but yes, there are certain contributing or risk factors, or certain group of people who are more prone to have this condition. And who are those? So this is usually developed after you are immobilized, mobile, active. You are not mobile enough, you are not active enough. It can be due to your sedentary lifestyle, or it can be due to after certain recovery stages of certain illness. It can be there, like you having a stroke and you are on the bed rest, so you are not supposed to move your arm. So in that case you may develop. And in diabetes, if you are diabetic, yes, there are chances that you may develop this condition. Certain diseases are associated, like diabetes, thyroid, if you are having thyroid, if you are having heart problem, you are having Parkinson. So these things are associated with the frozen shoulder. And if we talk about the gender part, yes, women they are more prone, they are at higher at risk. And being in 40s or 60s, like there is an age bracket that is 40 to 60 years of bracket. If you fall in this bracket, there are chances that you may develop this condition. Immobile, or being female, or having certain diseases make you this condition. Symptoms part, what sign or symptoms you can develop? Usually we describe this problem in like 3 stages. There are stages of frozen shoulder, and these are like freezing, frozen, and thawing stage. So these are the stages. And the freezing stage, this is the initial stage, and most important thing, usually if you are not having any kind of treatment, so there is a natural recovery, but it takes time, like almost 2 to 3 years it takes without having even any kind of treatment. So the starting stage is like freezing. In freezing stage, you having stiffness and there is a pain, and you are not able to move your shoulder. There is a difficulty of moving your shoulder. So this is a first stage, and this usually lasts like 6 or 9 months. Second comes frozen. Pain are decreased, means you are having not that severe pain, but stiffness is remarked, means you are having the more stiffness is there, and you are not even able to lift your arm. So this is the second. And the third one is thawing. In thawing, you are on a recovery stage, means your pain are decreased, your stiffness is decreased, means better, and yes, you are able to move your arm. Usually these stages, like the first stage like 6 to 9 months, and the second one is 9 to 12, and the last one is again 9 to 12. So are recovered within 3 years without any kind of treatment. But obviously for faster results, you need medical attention. You need medical attention, obviously, if your pain are severe and they are hampering your lifestyle. So the diagnosis part. See, frozen shoulder is usually, confirmed by the physical examination. You approach to your doctor, and yes, your doctor do your physical examination, and it is almost finalized that yes, you are having frozen. Why? Because you are not able to lift your arm, you are not able to move. There is a difficulty of moving. There is a restriction of movements are there. So the final diagnosis is made, and there are tests like there is a active. We call it like active means you are moving on your own, and your doctor notices that how how much or like how severe is your joint is affected, whether you are having pain or difficulty in movement. And there is a passive ones, your doctor give you support and then you rotate with the help of doctor. So in that case everything is considered and the changes are considered. And yes, for ruling out other disease, like if you are not having torn rotator cuff, you are not having any kind of arthritis, so for ruling out all these disease, x-ray, CT scan, MRIs, ultrasound can be done. It's almost like diagnosed in by physical examination. So frozen shoulder is diagnosed. Head for the treatment part. Allopathy first. In allopathy, as you are having, swelling is there, stiffness is there, so reducing that swelling and stiffness, you are provided NSAIDs, mean non-steroidal anti-inflammatory drugs you are given, and these are like aspirin, ibuprofen. They usually reduces your swelling, pain reliever, and they give you relief in the swelling. So these are the medicine. And at times if you have severity of the disease, so in that case you are given corticosteroid injection directly to your joint. So it depends completely that how severe your case. In some cases even like joint replacement therapies are there, physical therapies are there, physiotherapies are there for giving you the maximum result. Homeopathic approach. Homeopathy. See, homeopathy, yes, we focus on the diagnosis that you are having frozen shoulder. What matters us at last is your symptoms, your totality of the symptom, your holistic approach, whether it is on the left side, on the right side, what time you get aggravated, your complaints are aggravated in the morning or at bedtime, and what kind of things you are having, means whether it is painful while touching, painful while movement, or better by movement, or better by rest. So these things matter a lot in homeopathy. And if you're watching on YouTube, I have provided all medicines link in description box below. You can buy medicine and you can start your treatment. Stocks is the top grade medicine in homeopathy for any kind of like stiffness. If there is any kind of stiffness, any kind of joint restriction movement, so the stocks is the first choice, top grade remedy. So this covers your stiffness as well as your pain during night, stiffness, movement restrictions, and this give you like best results. Use with the help of dropper directly on tongue, 1 or 2 drops direct on tongue before having your meal. And this is the clinical purpose medicine. You can even buy a smaller quantity and even start with the lower dose to be on safer side. So causticum is used in homeopathy once you have the heaviness in the shoulder joint, like movement difficulty you have. So causticum again works wonder. You can use medicine according to your case and try to use one medicine at a time. Don't buy all the medicine unnecessarily, not required. Brahmia is also works amazing in the right sided problem. If you have any right-sided complaint, joint problem, Brahmia usually given when motion aggravation, means motion aggravate your problem. Brahmia is having acute pain, means you are having shooting pain, sharp pain, stretching kind of pain you have. So in that case, stitching, and use Brahmia. Rhododendron is given when you have seasonal aggravation, means you are having, there is a problem aggravated during thunderstorm. So in thunderstorm, if you have joint stem, usually patients complain that when it is rain and when there is a lightning, there's a thunderstorm, then we are aggravated, and it happens usually with pal. Rest is that case you can use leadum pal. Whole arm is paining, you have pain, so you can use leadum pal. Metallicum, ferrometallicum is given when you have left side frozen shoulder. On the other hand, when you have right side, we have sanguinaria can. Having spondyloid, Baxen's homeopathy, spondyloid is given when you have like all the your case is not clear. So combination of the medicine, so you can buy even that medicine also. And this is given in like all the joint problem, frozen shoulder as well as neck, cervical spondylitis. So you can use this medicine. This is used in the with the dilution of the water. Just use 5 or 10 drops of the medicine. Start with the lower dose and just mix it with some water and just have it like twice or thrice before having your meal. All the medicines links are given in description box below. You can buy medicine from there and you can start your treatment. Hopefully this video can give you some amount of knowledgeable, informative. Please like, share and subscribe my channel. Press the bell icon to get notified. Keep watching, keep supporting. Thank you for your time. Thank you so much. Thank you.